Once you make an appointment with our office, a consultation appointment, you will meet the doctor at that appointment. He will discuss what you can expect, what he needs you to do preoperatively to prepare for the procedure.
During that consultation appointment, we of course are doing the clinical examination and obtaining records, photographs, and x-rays. But during that time, we also are spending time utilizing anatomic models, illustrations, videos, and textbooks to try and explain your current clinical state as well as the treatment options that you have in front of you.
You know, when we see a patient for the first time, we have to understand that they are coming to us with a problem, with a need, sometimes with fear and anxiety, and we really have to put ourselves into their shoes and understand their stress level and anxiety towards us and our profession.
I find that one of my biggest challenges in treating somebody is, number one, trying to break the ice, trying to make them understand that I'm a regular person. I'm not some doctor that's standing off somewhere that doesn't really care about them as an individual. And I try to make sure they understand that I'm here to help them. I'm here to do things for them.
We take great pride in the quality of care we provide to our patients. We understand that patients may be anxious or nervous when preparing for surgery. From the time they come in to the time they leave, we are with them throughout the process. It's important for our patients to know their dentists and doctors have referred them to our practice because they will receive the highest level of patient care.
When we get a chance to work with these patients from beginning to end, one of the best compliments we ever get about the work and about the treatment is when they tell us they don't have to think about their teeth anymore. That's some of the best compliments we can get. We can remove years, sometimes decades of concern over failing dental work, failing teeth.
One thing I'm proud of with our practice is all our surgeons care about the patient first. We do not want to have anybody go through a painful process when it can be avoided. And part of that is knowing what you're looking into, knowing what you're facing. And if you, the more you know, the better it is.
I like the patient contact. That's what I like the most about oral surgery and dentistry in general, is the ability to have direct one-to-one contact with patients. Patients who come to you because they need something done, they need some help, they're in pain, or a variety of other problems that they may have, and you have the opportunity to have a positive effect on their life.
Carolina's Center for Oral Surgery does a lot of fantastic things, of those which we do removal of wisdom teeth, we provide jaw surgery, we place dental implants, we do reconstructive surgery, we do jaw surgery, corrective jaw surgery, we do cancer surgery.
The majority of oral surgeons in the United States simply take out teeth and put in the occasional implant, but we strive to do more than that. We are competent in major facial surgeries, jaw reconstructions. We're trauma surgeons.
We're the only accredited oral surgery practice in the region, one of only 2 in the state, and what that says is we put a lot of emphasis on patient safety, patient care, and we do that by putting our resources, both our staff resources and our financial resources, into providing a facility where someone can come, their daughter, their son, their parent, or themselves, and they can know without a doubt that we have taken every precaution to make sure that their visit will be safe.
We all have the same compassion for patients. We all have the same desire to make our patients feel comfortable.
When we have patients that have had great results and we know that they've had an improvement of their condition and we've changed their life, it reminds us every day why we do what we do in our profession, and it keeps us coming back day in, day out.
When you have an opportunity to practice a specialty like we do, patients obviously are very apprehensive before they have anything done. They've heard stories before, they may have their own imaginations about what things are going to be like, and there's a lot of concern, and that's understandable. But when you start at that point and you can bring somebody all the way around to the completion of treatment and you find out what it can do to change their lives, and to know that you've sort of brought them through that entire process, there's really nothing better professionally that I can think of.
Rest assured that with Carolina Center for Oral and Facial Surgery, you've made the right choice. You're going to get the experience of a top trained surgeon who will take care of you like you're a member of their family.